Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Ben Blanc, from the heartland of the United States, Indianapolis, Indiana. He is our Associate Director of Digital Production and Engagement. So Ben, have you been following the Paris Olympics?
I have been, yes. I actually even hosted a party for the opening ceremony last week at my house. What sports are you going to be watching, Robert?
I have been following the soccer very closely, football.
Shocker.
As the rest of the world refers to. And I have to say, it was disappointing. Good for you as a Frenchman. France beat the United States in the opening game. But, I'm going to be following the traditional sports, swimming, wrestling, boxing. It's a smorgasbord of different sports that you typically don't see on an average day in the sports conglomerate in the United States. So looking forward to this 2 weeks.
Yeah, agreed. Exciting times, Robert. There's so much we could talk about in this episode. There's definitely a lot in the news for the upcoming elections, and perhaps one thing that flew under the radar is the recent FTC report on pharmacy benefit managers, commonly known as PBMs. I know you always have a lot to say about PBMs, so without further delay, let's get started.
Let's do it.
So, Robert, you know the drill. I want to start the episode with a number. What if I tell you the number 80%? Does that ring any bells?
Absolutely it does. And that's the number that FTC put in its report. And FTC, by the way, stands for Federal Trade Commission. And what FTC said is that 80% of the retail marketplace in the United States is managed or is sort of like it's an oligopoly of three companies: CVS Health / Caremark, Cigna / Express Scripts, which is the PBM, and United Healthcare / Optum Rx, which is the PBM. So three large PBMs and insurers manage 80% of the retail prescriptions that are processed in the United States.
Well, that's a great way to introduce to this topic. We're unpacking a crucial report that the FTC just released in June. The FTC is a U.S. government agency tasked with promoting consumer protection and eliminating harmful anti-competitive business practices. Today, we delve into their findings on PBMs, and this recent report sheds light on how PBMs influence drug costs and pharmacy operations, revealing significant impacts on both healthcare providers and consumers. So, Robert, the FTC report highlights an unprecedented level of concentration and vertical integration among major PBMs. Could you explain how this has affected their control over drug access and pricing?
Well, the vertical integration and the horizontal integration are two different issues. So the horizontal integration is when PBMs, pharmacy benefit management companies, buy other pharmacy benefit management companies, and they consolidate as such. That has been going on for the last 2 decades, actually. The market has become an oligopoly of three large PBMs with regards to management of drug benefits. And that's CVS Health at Caremark that we talked about, United Healthcare Optum, and Cigna Express Scripts. What has happened in the last 5 to 7 years is that we've seen vertical integration. So in vertical integration is that when the PBMs or the insurance companies now are either merging or buying each other out. And that's what has created not only an oligopoly of insurance providers managing drug benefits, but also the PBMs consolidating on their own, which has happened over the last 2 decades. So what FTC has shown is that the market concentration is significant, and that in fact, where there used to be multiple PBMs about 2 decades ago functioning in the marketplace, now there's primarily 3 PBMs, and the rest of the market is hodgepodge of smaller PBMs that are trying to survive. But on the back end, because of this vertical integration between insurers and the PBMs, now you've seen the health insurance market also consolidate in these 3 companies. So they've found that by doing such things as vertical and horizontal integration, PBMs have an overabundance influence on drug pricing and also affordability with regards to what they can charge consumers. So the other thing, Ben, I want to make sure everybody's clear is that this is an interim report, that there's more to come from the FTC. This is the beginning of their investigation into this stuff.
Now, off the cuff, I'm a patient. I should be paying attention to the PBMs I get my drugs from. And how do I do that?
You need to be diligent, and they make it very difficult, to be honest with you. It's much more simpler to find out your provider and the hospital. There's a medical benefit, then you would choose your medical benefit based on whether or not your physician is in network, for example, or the hospital that you want to go is in network. But patients need to do a hell of a lot more work to figure out if their drugs are covered. And they make it extremely difficult for you to figure that out up front. They may tell you, for example, this is your out-of-pocket cost for a generic or a brand name drug, but they don't tell you exactly whether your brand name drug is covered, whether the generic is in a different tier that your out-of-pocket will be higher, or even the brand name drug is in a different tier of formulary coverage. So formulary coverage information is extremely hard to come by. It's extremely difficult and opaque to figure out, but patients need to do better due diligence. The reason being is that, Ben, it's great that you can go to the physician that you want to go to or the hospital. You can be near a hospital that you want to go to in case of emergencies. But as a patient, if you don't have access to these medicines that are going to help you manage or cure you of the disease, then what's the point? So to me, physicians are important and providers are important that you need to go to. But if you don't have the tools and the ability to manage your disease, then everything falls apart. And as a patient, that's where you need to be concentrating on.
Gotcha. Well, thanks for providing such a clear picture of the overarching influence PBMs have. Now, considering these dynamics, independent pharmacies are crucial to many communities. What does the FTC report reveal about the challenges these pharmacies face due to PBM practices?
Well, the FTC sort of confirms what we've all known, which is the PBM business model really undermines the community pharmacies. And it's unfortunate because in some cases, FTC also found that the PBMs favored their own pharmacies. Because remember, PBMs are not just processing prescriptions and developing formularies, but now they're in the business of dispensing specialty medicines. About 70% of specialty medicine dispensing today comes from 3 specialty pharmacies that are again owned by the 3 largest PBMs. So because of that reason is that the FTC found that they are giving better reimbursement, better deals to their own pharmacy-owned pharmacies than to the independent pharmacies. So in other words, they're trying to sort of run them out of business. And this is important, Ben, because last week there was a hearing in Congress and the 3 large PBMs were on the hot seat and trying to talk to them. And in one of the sort of retorts between the congressional member and the PBM mentioned that, no, in fact, they have a great relationship with the independent pharmacies and privately owned pharmacies. And I believe one of the congressional members had to remind the PBM executive that they're under oath. So they can't lie about this stuff. So that's one of the big things that came out of the FTC is that they're undermining the business model of these independent pharmacies. And the way they are doing it is through reimbursement differential that they're giving to better reimbursement to their pharmacies with regards to their drug pricing versus the independents. In other words, they're trying to drive them out of business so they can capture 100% of the market.
Well, actually, let's double down on this. You've just mentioned it. The FTC report also covers extensively the issue of PBMs owning their own pharmacies. So what does that tell us about the competitive landscape there? What does it mean for consumer choice and drug pricing?
Bad. Anytime you have a monopoly or oligopoly in this case, market competition is set by individual companies. And whenever they have market power, they're going to increase prices overall. So it's bad news for the consumers. But the other thing that we have to talk about, Ben, is that not only they're setting out prices and what the consumer ends up paying for, but they're also developing these formularies. Because remember, PBMs are not just processing prescriptions, they're developing formularies. So they're developing the access that you have to these medicines. And then they determine how much you have to pay for it. In addition, they're now dispensing these drugs. And we talked about it, how their pharmacies are favored over independent pharmacies. So overall, what PBMs have become is the judge, the jury, and the prosecutor. They're basically covered the entire market through an oligopoly. And that's what the FTC has confirmed. Something that many of us have been talking about over the last several years, if not over a decade, that we need to sort of parse out and break up these monopolies or these oligopolies. What the FTC has confirmed through their report is everything that we've been saying has been true. And now we have a government document that we can refer to.
Well, now let's dive deeper into the specifics of PBM PBM operations and the role of formulary design. So formularies determine which drugs are covered by health plans. How do PBMs use formulary design to influence which drugs patients can access and at what cost?
Well, the intent of formularies initially was to cover or favor the most cost beneficial intervention in the marketplace, right? So formularies were designed to promote generics, for example. What the FTC report found, and actually this is nothing new, again, we've been talking about this for a long time, including on this podcast, is that formularies have turned into a profit maximizing endeavors. The whole intent of the formulary through a PBM lens is to cover the drugs that will bring the best profit to the PBM, the highest margins for the PBM. Therefore, there are cases, and FTC has documented that, we've documented that at GHLF through our research, where the PBMs favor more expensive medicines in comparison to a less expensive generic, for example. They favor a brand name drug versus a generic. And the reason being is that the margins are better for them. So all you hear from the PBMs when you bring this up to them and you challenge them on this endeavor, and we've done it at GHLF through our research and also through our communications, is their response as well, the net price is favorable. But you have to always ask as a patient, as a consumer, net price to whom? I'm 100% certain that the net price to the PBM is better because they're making better margins off of it. But that's not necessarily the case for the consumer. And by manipulating formularies, and that's another thing FTC found, that they favored these more expensive medicines in view of less expensive generics. By favoring these more expensive medicines, the patient ends up paying more out of pocket. Now, the PBM is saving money for themselves, but they're not passing any of those savings on to the patient. So therefore, it's a profit maximizing machine, and the whole premise of formularies has been turned upside down, where instead of favoring the most cost beneficial intervention, what they're favoring is the one that brings them the best profit.
Well, let's keep talking about this. Now, rebate negotiations. They're a key aspect of how PBMs operate. So what are some concerns raised in the FTC report regarding PBM's rebate practices, especially in relation to generic and biosimilar drugs?
So rebate contracting is the premise that creates all of the misaligned incentives. Because what rebate contracting does is to say, look, I will cover this drug by the pharma company if you give me 50% rebate back to the PBM. So let's say you have two drugs, right? Identical, and they can be interchanged. Patients can take one or the other. One drug is priced at $100, but the pharma company agrees to give a kickback or a rebate of 50% back to the PBM. That reduces the price, net price, to $50 for the PBM. The other drug priced at $50 straight out. So there is no rebate. It's just $50. PBM will always prefer the $100 drug and the 50% rebate because there's two reasons why. Number one, they never pass 100% of the rebates back to the plan sponsor or the patient. They never do. It's maybe in the 90 percentile, maybe it's in the 95, 80 percentile. So they keep a percentage of that. The second reason is that as soon as you get into rebate contracting, there are other things that come up, which is fees. And fees are the ones that have been growing faster and where profit margins are better because they never have to share any of the fees with the plan sponsor or the patient. So in other words, rebate contracting creates misaligned incentives by promoting higher price medicines. In addition, it triggers other type of fees and concessions that pharma companies have to give that are never ever shared with the plan sponsor or the patient by the PBM. So rebate contracting, it's like the starting point of all the problems that occur in the marketplace. Now, there are insurers and companies that don't use rebate contracting, and they get very favorable pricing, and that price is passed directly to the patient. One of them being Kaiser. Kaiser does not use a PBM to negotiate drug prices, does not use rebate contracting to negotiate prices. What they negotiate is a net price, and that net price is reflective of what the patient ends up paying.
Yeah, very clear. Now, with rebate practices influencing market dynamics so strongly, what potential reforms or regulatory measures could address these issues to improve drug affordability and pharmacy viability?
So, first of all, remember when we started, we said this is an interim report. So there's more to come. In fact, the FTC mentioned it at the end that we need to talk about influence on drug prices, how are drug prices set, things like that, specifically diving more details into that. So more to come from the FTC. There's also been reports in the media that FTC is preparing to litigate, to sue these PBMs. Part of this lawsuit will be to break them up or perhaps to create an environment that they cannot do some of the practices that they currently engage in. There's also ability for congressional activity, and there's been active discussion legislatively on the federal level. Definitely on the state level, they've passed some legislation to regulate it, but we need federal legislation to be able to do three things. Number one, to create transparency. That's the starting point. We need to figure out where every dollar amount that as a concession is given by the pharma company goes to. Does it stay as a profit margin for the PBM? Does it go back to the consumer or to the plan sponsor? So the number one thing is transparency. The number two thing is to really hone in and define, does rebate contracting really influence the marketplace and the formulary design? And number three is really to be able to say that there needs to be a separation between fees and the price of the medicine. This is the linking thing that everybody talks about. And that's gotten the most opposition from the PBMs because they know they make a lot of money. But there's other things that legislation needs to do. For example, there's patient steering. Should we forbid the PBM from steering the patient to their PBM-owned pharmacy and instead the patient can go to any pharmacy? So that's another part of the legislation that needs to be addressed. So there's multiple areas that legislatively we need to address. It's very detailed. We don't have time to go over every piece, but there's definitely activity from an FTC standpoint, from a litigation perhaps, and also congressional activity with legislatively to sort of curtail some of the market dominance that has created all these problems in the marketplace.
Well, so my take on this is that there is a need for greater transparency and potential regulatory reforms to ensure that drug prices are fair and that pharmacies can operate on a level playing field. But Robert, you're the expert, so you have the last word.
The last word is that this is just the starting point. The transparency is the starting point, but we need to do more. And FTC's report has shined light to a lot of bad practices that PBMs engage in, not only undermining the marketplace from regards to patient access and affordability, but how they're trying to drive out competition from the market and make it more of a monopolistic marketplace than it is right now. So the last word is that as consumers, as patient advocates, as employers, we need to advocate for both the FTC to move forward with litigation, but also for active legislation federally to curtail these practices. Ben, one of the things that came out at this hearing is that the three largest PBMs have these companies that have put on offshore. They have companies ex-US that are called group purchasing organizations. The question from the congressional members was, why are these companies in Ireland and Switzerland and not in the United States? And the PBMs didn't have a good answer. And the reason being they've set up these companies offshore is because they anticipate some type of legislative activity or legal activity coming up, and they wanted to protect themselves by setting up these companies offshore.
Well, thanks for breaking that down for us, Robert. To our listeners, don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It'll help more people like you find us.
And Ben, we're going to put the FTC report in the show notes. I assume that everybody can take a look at it. And as always, for our audience, if you have any questions, please send it to us. And even if it's some suggestion for us to delve into further with regards to the discussion on PBMs, drug pricing, drug affordability, or any of the other issues that we cover on our podcast, please email us at podcasts@ghlf.org. Please engage with us. We're always looking for feedback.
And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Ben Blanc, and we'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.